Hi everyone, my name is Manasi. Today we're going to be doing the first session of a little series that Miman and I are going to be doing. That's going to be covering the specialties in dentistry. There's around 13 specialties, so we're going to try and cover at least 2 per session. Okay, so today I'm going to be covering orthodontics and Miman's going to be covering Maxfax. So what does the day in the life of an orthodontist look like? So one thing is patient assessment and treatment planning. So this would consist of like evaluating patients' needs, taking impressions, which are molds of the teeth, and these help create the treatment plan needed for the patient to determine where different teeth need to move and how the braces need to be fitted according to that. They also use things like x-rays to make these treatment plans too. So then there's brace fitting and adjustment, and this is like the technical part of it. So this is physically fitting the braces by placing brackets on the teeth and adjusting them at regular intervals, monitoring the progress of the teeth movement. So because of this, there's also you're having a lot of interaction with your patients because you're seeing them quite regularly to get their braces adjusted and etc. This can also consist of carrying out calculations to figure out exactly where different elastics need to be placed in order to ensure optimum results for the patient. And this is one thing that I saw during my work experience, which really intrigued me and piqued my interest into orthodontics. So once the treatment is complete and the patient has the results that the orthodontist and the patient have discussed, they will remove the brackets and drill off any remaining dental glue that is left on the teeth. It's straight after this that they will also take impressions of the teeth in order to make a retainer. And these retainers will be fitted and adjusted to the patient. It's really important for these molds to be taken as soon as the braces are taken off, because leaving it any longer can result in teeth movement. So in order to ensure that that smile is maintained, the molds need to be taken as soon as possible. Then there's interdisciplinary collaboration. And so for certain complex cases, so when there's overcrowding or extra teeth, missing teeth, they may work alongside other specialist dentists, such as the restorative dentists or surgeons. Finally, there's like administrative tasks. So this encompasses quite a few different things. So this is things like managing referrals, managing patient documentation, communicating with other staff like receptionists, and maintaining their registration by participating in ongoing education, which is especially emphasized for orthodontists working in NHS dentistry. So I've highlighted that at the bottom of the slide as well. What does this specialty involve? So, as I said in the previous slide, alignment of the teeth and jaws, use of braces and retainers to achieve this. And it's a profession that's mainly associated with working with children, although now we are starting to see a lot more adult orthodontics happening as well. So, like any profession, there are key skills that you need to be an orthodontist. One is manual dexterity. For any aspiring dentist in the room, this is something that you must have heard like a million times. You need to have good manual dexterity because being a dentist is a very practical, technical job. And especially for an orthodontist, because there's a lot of intricate procedures that need to take place that require very precise movements. Next is knowledge of dental mechanics. So in order to be an orthodontist, it's important and it's preferred to have a strong background in maths in order to calculate forces and movement of teeth to create treatment plans. So it's really, really good for anyone who enjoys the more calculated sides of things, along with healthcare. Then is good planning. So as I said in the previous slide, good planning is really important to ensure the patient understands the treatment that they're going to be receiving, and to ensure that the patient is actually getting the optimum care that they need. Because it's especially important for the communication side of things, because they need to fully understand what's going on, because this can be quite a complex thing, and because it's teeth, we can't exactly say how things will progress. So it's the time frame is also for having braces is very it can change a lot depending from patient to patient. So how can you get there? So first, you take an undergraduate. You need to complete an undergraduate degree, which will be a Bachelor of Dental Surgery or a BDS. Then, once you're qualified as a dentist, you need to gain experience in as many different fields of dentistry as you can, gaining lots of experience and things like that. Then you need to apply for an orthodontic training program, which will give you the certification of an MORTH. And once you've completed your MORTH, that you are qualified as a specialist dentist. So what happens after that? Okay. So there's, as I said, as on the screen, there's 4 different main things you can do after qualifying as a specialist dentist. So one, which is the most common route, is becoming a specialist orthodontist in primary care. So this is the most common one, as I said. So this will be managing a range of orthodontic cases within general dental practice, and this can be under NHS or private. Then there's consultancy under the NHS. So those seeking a career in hospital settings can pursue a 2-year full-time post-CCST, which is a certificate of completion of specialist training program to become a consultant. Then we have clinical academia. So this could be teaching or running research in a university setting. Finally, there's further studies. So this can be after your MORTH, or it can be during even, because a lot of trainees decide to study for a higher degree alongside their MORTH, such as a Master of Science, a Master of Clinical Dentistry, or a Doctorate of Dental Surgery. So on that note, that's the end of my bit on orthodontics. Now, Miman, I'll be handing it over to Miman, who will be covering MaxFacts.
I have a question for everyone. This is the question of the session. So the question is, what do you guys think consultants in oral and maxillofacial surgery do? You guys, do you want to put your hands up or just shout out? Okay.
They do like surgery around the neck and the mouth and the jaw, basically.
Oh, that's great. Does anyone else?
Bone grafts for patients with cleft.
Oh, okay, yeah, cleft, lip and palate, that's a great point. That's great. I didn't expect you guys to actually know that, so very knowledgeable. So in brief terms, they treat and diagnose patients with diseases affecting the nose, mouth, jaw and face. So, next. Let's have a little delve into the responsibilities of an oral and maxillofacial surgeon. So first of all, when treating patients, they deal with a great variety of patients, ranging from children to the elderly, and each have very different surgical needs. So when you're treating children, cases tend to involve children that are born with deformities or that develop deformities in their face or skull. So an example of this, as Manasi said, was cleft lip and palate, and I have a little picture for you guys. It's basically where the upper lip and palate are conjoined, and this is what oral and maxillofacial surgeons this is an example of what they have to deal with in children. So it's formed when, in the womb. Now, in the case of older patients, you can expect to deal with like skin cancer or tumors on the face and head. So Next, non-surgical management. So the non-surgical aspects of oral and maxillofacial surgery include dealing with facial pain, disease, and infection. And this task can be carried out in either surgery or outpatient clinics. So outpatient clinics in like the section of the hospital, or surgery, like if you think of where surgeons go to do dental surgery, that's like the sort of environment you can be working in with this sort of role. And it also involves working alongside other medical and dental professionals. So yeah, that's cool. And then last, let's look at the surgery and technology side of things. So surgery can range from operations such as removing a wisdom tooth, treating skin cancer in a clinic, or performing a complex facial reconstruction, which can take many long hours. And alongside working with other specialists, oral and maxillofacial surgeons operate using the latest techniques, such as 3D printing or microsurgical techniques. So in the case of 3D printing, it can be used to make models, which can help to plan surgery ahead of time by navigating the complex features of the skull and face. So it gives them a little bit of a guideline on what they'll be doing in the actual thing. Whereas regarding the microsurgical techniques, this involves transferring tissue from one part of the body to another. So as I said, in face transplantation, you will be using this technique because you're replacing all parts of the tissue on one person's face from a skin donor. Okay, great. Then next, the pathways to becoming an oral and maxillofacial surgeon. So, I have another question for you guys. Can anyone guess the degrees needed to specialize in oral and maxillofacial surgery? Okay, do you guys want to shout it out?
Medicine.
Dentistry.
Okay, I heard medicine and dentistry, which is great. So yeah. Medicine and dentistry is right. You need a degree in both medicine and dentistry. So the most common pathway to becoming one is by doing an undergraduate course in dentistry, and then either another undergraduate or postgraduate course in medicine afterwards. That's around 75% of applicants. It's not the shortest way, I'll talk about that in a minute. So if you come from a dentistry background, it will take 13 years, whereas if you come from a medical background, it will take 11 years to become one. So yeah. And unfortunately, you will need to fund your second degree. So yeah, you have to think about that if you want to become one. Yeah, the pay is really good, but you will also you need a lot of money to actually get into the job. So, next. One last question for you guys. Can anyone guess how many oral and maxillofacial surgeons there are? If you just want to call out.
In what?
In when? Just
In
the UK?
the UK, yeah. NHS.
100.
100.
50.
1,000.
1,000.
2,000.
5,000.
1,500.
This isn't a bidding, okay? We just say what we think there are. So, yeah. It's almost, you guys were close, sort of. There are actually 382.
200.
Yeah. Working under the NHS in England. And to give an idea of the competition, how many people actually do want to become one? In 2020, there were 32 applications for 10 specialty training places. So yeah.
What is it? 32?
Let's move on.
Only 32.
Oh. What's the bit we've all been waiting for? Does anyone want to guess?
Student of the day.
Almost.
Oh.
The end.
What's interesting about dentistry? It's the pay. Let's talk about the pay. So, foundation training, when you're on your foundation training to become one, you'll be earning 32,000 to 37,000 roughly annually, and this is around 2 years long. And then, moving up the ladder, consultant. Once you become a consultant under the NHS, you can be earning anywhere from 90,000 to 130,000-ish. And when I was looking actually at the job vacancies, most of them were well over £100,000 if you are applying as an experienced consultant. So yeah.
Is that for
Yeah.
the surgery or just the
Yeah. So this is just for maxillofacial surgeons. Entry-level positions start at £67,000. So when you first start out, you might get a starting salary of this as the minimum, and then you can only go up from there. So that's great.
Wow.
So yeah, the average maxillofacial surgeon salary in the UK is £93,764, which is around £48 and 8 pence an hour. which is great considering the amount of hard work you've put in to get there. Yeah. Thanks everyone for your attention.
Yeah.